Good morning, Dr. Christine Rankin from South Metro Wellness. Welcome back to our channel. Today we're going to be focusing on a very popular, much used physiotherapy here in our practice called electric muscle stimulation, or EMS. Many of our patients come in, they begin to get the therapy, they go through their chiropractic treatment, they do very well, and then 5 or 6 months later will stop and ask me, Dr. Rankin, why do we do this stim, or why do we do therapy? I know it feels good, I like it, but what's the purpose of this? So today we're going to do a step-by-step demonstration. It's very simple, it's very clear and straightforward so that you guys know at home exactly what EMS is and how to use it properly if you're going to be purchasing an at-home care product, which someday in the future I hope you do. It's wonderful. So I've got my pads here ready. These are Squircle pads. I'm going to take them out. There are 2 sets per packet. Anytime you're using, whether it's commercial grade, which is what we use here in my practice, which is what the demo is going to be for, or an at-home, you're going to get a set of pads or a set of pads of 2. Okay, so basically when I take these off, the pads are going to come off the plastic. They're very sticky, okay, and that's a good thing. They're going to be fitted very closely to your skin, okay? And what the muscle stim does is it delivers a safe amount of electrical stimulation from the pad, from the machine, into your skin, into the muscle, and it's going to cause a twitch reaction. It's going to make your muscles contract and relax at a level or a rate that is much higher than what it could normally do by itself without therapy or without any kind of help, right? What that's going to do is reduce tension, stress, inflammation, and it's going to increase circulation, allowing the area to be more palpable. It's going to help reduce stress and pain in the patient. It's also going to relax the patient. And when I, as their doctor, go in to perform the treatment, or our massage therapist goes in to provide or perform the treatment, it allows a much more relaxed, effective, productive treatment because you've already reduced pain and a lot of the barriers that help us get deeper into your body to allow the therapy to do its job. So we're going to take these 2 pads right off of here. Set these guys down. All right. And I'm going to use my elbow and forearm as the demonstration. Many of our patients go right behind the neck, the upper traps back here, right across the belt line, what have you. These muscles are postural muscles, and they're muscles that constantly get wear and tear and are worn out, so have to be repaired and restored. I'm going to go right here on top of the supinator muscle because as a chiropractor, I use my wrists and elbows constantly. And if you're a person who types a lot or works at a grocery store, you overhand often, you're going to find some tenderness here in these muscles if you palpate it at home. So I'm going to go right there on top. Might have stringy pear-like texture, which is not healthy. It's something I have to work on as a patient myself. With this type of therapy, we can go, or this pad placement, we can go right above the elbow on the internal, or we could go right above the elbow on the external. I think for this purpose, we'll go on the back so that you guys can see. All right. Hopefully you've read your instructions properly and your machine is turned on, and that your leads, which I have 2 here because I've got 2 tables where I can simultaneously work on more than one patient, that your lead is hooked up correctly. So I've got black. And I've got black, my machine is on, and I'm going to go ahead and begin to turn the muscle stimulation on. When a patient is face down, they can't see me, so I make sure I give very clear instructions as to what it is we're going to be doing if it's their first or second time, as well as what they should be feeling. So as I go ahead and start to hit this button up here, the up arrow, the patient should start to feel a little bit of a tickle or a little bit of a tingle before their muscle starts to twitch. Now, the machine is going to tell me when the muscle is at full conductance. If the patient tolerance is not there, it's not going to happen. Okay, the number 1 therapy, or the number 1 rule that I use in my practice, that is pretty common, universal rule. First, know when to not do harm. It's very important that all of our therapies are done to patient tolerance. Otherwise, it's completely unacceptable. Okay, safety is safety first, second, and third, right? So we're going to go ahead and turn up here. You may feel uneven stimulation. For example, I feel more stimulation over here than I do right in here. Okay? Could be a number of things. Sometimes it'll be backwards. If a patient is more sensitive or more injured in one area, they're going to feel it stronger. If a patient has a long-term condition where there's more scar tissue there, it might take more work to actually get the therapy to do its job. I'll turn away from you guys for just a second. Let you know what I'm doing. Okay, so these muscles I'm working on are very small, and I don't use muscle stim on myself very often. So we are here at low conductance, and I can feel a pretty decent tingle. There's another one. And as it gets higher, for purposes, I won't go too high. Okay, so basically I can see on the top that my muscles are twitching. On the bottom, it's pretty sound. It's just enough to get by, okay? So in the future, what I would want to do is put 2 pads right on top of that area, which I don't always recommend. I think you should basically even it out just a little bit and treat the whole muscle group. If you're going to treat one side, treat the other side so that you maintain balance and symmetry, okay? And I'll go ahead and hit the start button. Patient tolerance has been achieved. Even though full conductance has not been on smaller muscles, that's what you will get. We'll let the stimulation go for 9 or 10 minutes. Sometimes we bump it up to 12 or 14, depending on how much time, pain, or how long the patient has been coming. If a person's been coming more and their tolerance is up higher, I'll bump up the time. It's also a very good idea to use a hot pack or a cold pack on top of your muscle stim. That way you can get an additional physiotherapy. If you are positive for inflammation, use a cold pack, okay? If you're brand new in care, or if you're treating something that's very acute, very fresh, please use an ice pack. You want to reduce inflammation, which will also be enhanced by the muscle stim. 2 very, very easy things you can do at home, okay? I'm going to go ahead and hit stop here because we don't need necessarily keep going, okay? I'm going to reduce the pads here. Super duper sticky. And then when they come off, they're not. All right, we'll put these guys back. And I'm going to show you guys an example of something you can use at home. The muscle stim, when used correctly, is a very, very safe therapy. It's a very comfortable therapy. You can pretty much use it daily or every other day, depending on what your health needs are. I'm going to show you an example here. We had purchased an at-home care, I want to say it was a little box. It was an at-home treatment. Came in a little blue box, and it had a pocket TENS unit, TENS, okay? That is a muscle stim unit that you can basically own and use at home. You can find these on Amazon, you can find these at wellness stores. They're very popular because they're very effective and they're safe and you can use them anytime. When we purchased one of these to give to one of our patients, it also came with a pad placement chart, okay? So if you have any questions about what it is that you should be doing, you can use the electric muscle stim on nearly every postural muscle group in your body. If you are an athlete, yes, you can use it on your upper abs, your lower abs, your hips, your glutes, the back of your thighs, the back of your calves, the back of your knee, or an ankle, even on your foot if you absolutely had to. They will give you a couple different ideas about what to use. For example, here's the lower psoas muscle if you're a runner, along with the upper leg or lower leg where your knee. Basically, they turn the patient around. They're going to be using 1 pad on each of the lower lumbar areas right above the belt line and down the back of 1 thigh. Okay, up here they'll go the back of the arm, the back of the shoulder. There's a number of ways you can do this, and there really aren't too many wrong ways as long as you're being careful and respecting your body and listening to what your symptoms are and as well as what your tolerance is. Okay? I'll show you guys an example here that was brought in by our videographer and former patient. This is a good example of a take-home. See, it basically could fit in a pocket. It's so convenient. It comes in a little box or a little zip-up piece. This is EMPI. The product information is all inside. They'll give you a handout, instructional manual on how to use it. Okay, the first thing I always say is make sure you got the batteries in and turned on. Okay, that's the main thing. Once you go from there, they'll give you very, very clear instructions. Here are the extra pads. They're going to come in a packet like this. I believe there are even some cleaning supplies in here. Yep, clean cut, skin wipes, so you wipe your skin. Okay, and then some larger ones, even some larger pads. It is also important to note there is more than one size of pad depending on who is using it. Okay, so if you're an athlete and you've got long legs and you're a runner, you really want to work on your IT band, a bigger pad would be really, really cool. If it's a person who's just like me, who's just going to be using it for the elbow, the small circular or squircle pads, which is what our Jade Trodes are more than sufficient. So you take the pads off, see? It's all sticky. I don't want to use these pads because they're somebody else's. But basically there's more than one channel. So there's 1 channel, there's 2 channels, so you can run more than 1 set of leads at a time. So let's say you want to do your psoas and your thigh at the same time. You absolutely can. That way you can control it. One side you can turn up higher than the other. Pretty nifty, I think, actually. So these are little things you can take at home. And I would always encourage you, if you are a patient and you're needing help with use of your stim, every time a patient buys one of these products, I always recommend bring it in if you have any questions, because it's very straightforward and the instructions are really amazing. However, if you have any questions about what you should be doing, how high you should be turning things up, or where you should be putting your pads, always talk to your chiropractor, your physical therapist, your medical doctor, whoever recommended the TENS unit to you to help you out with it. We've had patients come in, show me the TENS unit. We made sure that the batteries were in, it turned on right, there was no technical issues with the product, and then we gave them a couple pointers on how to use it at home so that they felt comfortable. I want to say the majority of people don't use it any more than 20 minutes. I think that's more than enough. Then I would cease the treatment after that, so you don't want to put it on and leave it on for 30 or 40 or 50 minutes. That's not appropriate. Your body doesn't need that. Most of our patients here are between 10 and 14. If they want to go a little bit higher, we'll let them basically rest on the table with the heat pack or the cold pack on top, because once the timer goes off, the muscle stim is still working because it's worked deep inside your body. So in those muscles. So if you get off the table and the pads have been removed and you feel like they're still there, that's a good thing. It means that the product did its job, the therapy was very effective, and you're getting out of it what you need. That's all for today. If you guys have any questions, comments, or you've used a stim product at home and you like it, or you want to ask something about it, go ahead and leave that in the comments below. We'll go ahead and be checking those, see if we can get back to people regarding those, or if we'll have to refer you to another physician who has a little bit more information about your condition. As always, you want to use your physiotherapies properly and under the direction or supervision of a physician who recommended the product to you. If you have any questions, make sure you follow up with them. It's been Dr. Christine Rankin with South Metro Wellness Videos. I hope you guys enjoyed. Hit the subscribe and notification bell if you'd like to continue to see our wellness videos here. Have a happy new year.